Hi, and welcome to my first episode of Beating with the Facts. My name is Sonakshee and my mission is to spread awareness about how lifestyle, habits, and diet can affect our cardiovascular system in both good and bad ways. As the series of episodes go on, I'll be talking to multiple different health professionals with different insights. Today, we're starting to talk with Dr. Nayanjoti Kaushik, an electrophysiologist at CHI Health in Lincoln, Nebraska. Electrophysiology is a branch of cardiology that studies the electrical properties of biological tissues and cells. It can also refer to the branch of cardiology that focuses on diagnosing and treating abnormal heart rhythms or arrhythmias. Arrhythmias can cause the heart to beat too fast, too slow, or with an irregular heart rhythm. If not treated, arrhythmias can damage the heart, brain, or other organs. This can lead to life-threatening strokes, heart failure, or cardiac arrest. So, hi there, Dr. Nayanjoti. How are
Hi,
you?
Sonakshee.
How are you today?
Doing great. And thank you for having me as your guest. And I hear this is your first episode. So I take the honor to be the first guest in your podcast here.
That's wonderful. All right, let's get started. As an electrophysiologist, what are some of the main reasons patients come to you?
You actually did a very good job in explaining that, Sonakshi. As you said, it's a discipline of cardiology that deals with the heart rhythm disorders. So heart rhythms sometimes, depending on the etiology, they can be fast heart rate or slow heart rate, or they might go irregular, and they might cause symptoms such as palpitations, which is basically described as abnormal awareness about the patient's own heart rhythm. And you are very correct to say that such irregular heart rhythms sometimes can cause disabling stroke, heart failure, heart attack, or maybe sometimes even they can be life-threatening or lethal. There are different treatment options available, ranging from medicines to various procedures such as implantation of a pacemaker or doing a procedure on the heart called as ablation, which is like a cauterization inside the heart. But before that, you need to make a diagnosis. So basically, people are, cardiac patients, they are seen by cardiologist first. And once the cardiologist diagnoses their condition with a heart rhythm disorder, they will refer them to me for further potential cure or potential treatment options available.
That's nice. So are you saying that reasons like some lifestyle choices is that some of the reasons that patients come to you for arrhythmia to treat their arrhythmia?
Of course, lifestyle has a great and a very strong preventative role in all sorts of or all spectrum of cardiovascular disorders, starting from heart failure to heart attack to cardiac arrhythmias. Now, when you talk about cardiac arrhythmias, just to name a few, the most common cardiac arrhythmia that you will see on today's date is atrial fibrillation.
Mhm.
With advancement in cardiac science or cardiology, more better treatments are available and people live longer. As we live longer, as we grow more old, we develop conditions like atrial fibrillation or other sorts of tachycardias. Tachycardia in Greek, it means fast heart rate, so such as ventricular tachycardia. And we can definitely have control, a preventative role with good lifestyle change, such as choosing the proper diet, staying healthy, maintaining our physically active lifestyle, etc., etc., and so on. So.
Speaking of dieting, research shows that wrongly or blindly followed dieting, such as low carb diets and starving, and lifestyle can also cause or worsen arrhythmia. What do you have to say about that? Like, do people need to be more educated or aware? What are some examples of harmful diets or harmful lifestyles that are
A
related
brilliant
to?
question. Brilliant question. So these days, so much of information is available online or on the internet. It's very frequent. It's very easy to get misguided, and there will be mention about different dietary supplements to lose weight. Those are definitely harmful, and I would just say that unless you know what is the supplement or what could be its potential interaction with some of the other medicines that a patient is taking or some of the long-term consequence of those dietary supplements or herbal supplements that are sold over the counter, definitely don't go for those kind of things. But going back to your question, wrongly chosen diet such as starving may be unhealthy or may be detrimental depending on a person's body mass index, depending on his I guess his age, whether he's in a growing adolescent stage or a grown adult, depending on his daily caloric consumption, like how much of whether he does a sedentary lifestyle job or versus a physically active lifestyle. They do need to select or choose proper diet, which is enough to give them to meet their carbohydrate or caloric demands, or choose the healthy protein, low fat, and definitely a guided and educated diet is very key in preventing some of the cardiovascular disease or conditions.
So definitely not eating too much, not eating too little, and if weight loss is the goal, then to do it in a healthy way, such as exercising. Am I right?
You are very correct to say that. So, losing weight and obesity is the biggest pandemic right now. And what they studied is, the one medically proven diet is called Mediterranean diet,
Mhm.
where they used more extra virgin olive oil, some nuts, and they took more of fruits and vegetables. And amongst non-vegetarian diet, they chose to take more of fish and poultry, and they cut back on their red meat or processed meat, those kind of things. So if you follow a Mediterranean diet, I guess that's a very good diet to prevent any sorts of cardiovascular ailments such as coronary artery disease or heart failure or heart attack, stroke, so on. Exercise, yes, you should be moderately sedentary. What the American Heart Association is going to recommend is at least 45 minutes of exercise, medium intensity exercise, 5 days a week. That should be good. And controlling, and that also helps to control your body weight, treating conditions like obstructive sleep apnea, controlling your blood pressure in goal. Those are all which is going to earn big in terms of reducing the risk for any kind of cardiac arrhythmias or any other worse health outcome, in general.
Oh, that's nice. So moving on to the next question. What are some of the biggest causes of atrial fibrillator? Is that right?
Fibrillation. Yeah.
Yes, or arrhythmia that are more lifestyle related, such as smoking, alcohol.
Very good. So there has been studies done on effect of lifestyles like smoking or alcohol. With atrial fibrillation, we definitely encourage people to quit smoking if somebody is already using tobacco. Not only smoking, but tobacco in any manner or in any form, maybe chewing or smoking. Alcohol has a very strong correlation with atrial fibrillation, and there has been previously well-described situations, something called holiday heart syndrome. Sounds funny, right? So it's on Saturdays or the weekends, people binge on beer drinking, and next morning they end up in the emergency room with atrial flutter. So that is an age-old thing. We all know about it, holiday heart syndrome. But I think at that time we were still underplaying the or underestimating the risk of alcohol consumption. So now we are even more vigilant or strict about that. So moderation in alcohol consumption is very essential. They found in the studies that a few hours after drinking alcohol, people can develop atrial fibrillation or atrial flutter. Caffeine or coffee, there is no such strong relation. For many people, they are a little bit extra sensitive to caffeine intake, or they might feel that their heart rate is irregular. For those people, I would just say, refrain from drinking coffee or any kind of caffeinated products such as dark chocolate or anything else, or caffeinated beverage. In case they're symptomatic, that might help them to reduce the burden of the symptoms, but it's not so strongly related to development of atrial fibrillation.
Yeah, it's a good thing you talked about not only alcohol, but you also talked about caffeine because people of all ages usually drink caffeine. So speaking of all ages, like what is a typical range of your patients? Like are some of them teenagers or kids my age? Like does that also mean that arrhythmia can be genetically caused, not just lifestyle?
Very good question. So the age range of patients that come to me are that can develop heart rhythm disorders vary widely depending on the cause of the arrhythmia. Now, people those who are 18 years or younger, they will probably go if they have a heart rhythm disorder, probably they will go to a pediatric cardiac electrophysiologist. But yes, arrhythmia or heart rhythm disorders can be congenital, and we have lots of patients in second or third decade of life because they were born with a congenital condition that caused that arrhythmia, something like supraventricular tachycardia, or shortly known as VT. You might have heard about the term, or you might have come across the term on the internet, like Wolf Parkinson White, WPW.
Hmm.
So that is one of the condition that we treat. So those are the younger folks. And then the older folks, they usually have heart failure or coronary artery disease related arrhythmias such as atrial fibrillation or ventricular tachycardias. Now, speaking of genetic, yes, atrial fibrillation does have a genetic association. There are some young patients who are like 30s, who are like in their 30s or early 40s. They will still develop atrial fibrillation without having any of the traditional risk factors for AFib being present. We call them as lone AFib. We think there is some percentage of genetic association with atrial fibrillation, not very strong, but there is.
So definitely more lifestyle. Okay, that's cool. So what is the main takeaway you'd like to give to people about lifestyle and diet specific to electrophysiology?
Choose wisely. Watch what you eat. Take more of fruits and vegetables. Take a lot of fibers. If you want to cut back on carbohydrate, take more of fiber containing carbohydrate diet.
Mhm.
Less of animal protein or animal fat. Go for more plant-based protein. Extra virgin olive oil, nuts, almonds. Those are I guess those are the good dietary choices. If you can stay away, if you don't drink, that's good. For people, those who drink or takes tobacco, try to quit it, or
Mhm.
moderation in alcohol consumption. Stay active. Walk whatever you can. Walk every day, uh, maybe 10 minutes, 15 minutes, if not 45 minutes. But goal is to reach to 45 minutes or 10,000 steps a day. So lose weight. At least 10% of lose weight can work miracle.
Definitely, definitely. So stay in the healthy, weight range, good choices for lifestyle, moderation and all recreation habits, not too much exercise, not too less exercise. Then dieting, definitely have a balanced diet is what I took away from what you said. Wow,
Yeah.
that's amazing. Well, since we have a little bit of time left, for fun, what do you think is the best field in medicine according to you?
Well, I'll be biased in that, Sonakshi. To be honest, I will just say cardiology is the best field, and within the field of cardiology, obviously, electrophysiology is the most interesting part. That has been my passion. That's a dream I have chased since my medical school days, probably. So I guess if you ask me, it's cardiac electrophysiology, and I would like to encourage and inspire all the budding aspirants to choose this medicine. This is a fairly rapidly evolving niche field of medicine. Lots of new technologies coming around, lots of potential cure with which we can impact patients' quality of life, or maybe even save somebody from an unexpected worse health related outcomes. So electrophysiology is the way to go.
Wonderful. All right. Thank you so much for joining me today here at Beating with the Facts with me, Sonakshi, and our guest speaker today, Dr. Nayanjoti. And you heard him, guys. Balanced diet, lifestyle, and habits can definitely affect your cardiovascular system in a bad way and a good way. And this is specific to electrophysiology. So thank you guys for joining me today, and I'll see you in the next episode for Beating with the Facts.